Hey guys, it's Dr. Justin Marcagiani. Welcome to the Beyond Wellness Radio podcast. Feel free and head over to justinhealth.com. We have all of our podcast transcriptions there, as well as video series on different health topics ranging from thyroid to hormones, ketogenic diets, and gluten. While you're there, you can also schedule a consult with myself, Dr. J, and or our colleagues and staff to help dive into any pressing health issues you really want to get to the root cause on. Again, if you enjoy the podcast, feel free and share the information with friends or family, and enjoy the show. How you got into this field, because you were doing clinical research for a while and now you've moved more into the supplement side of the fence. So people will essentially hire you to kind of authenticate their products and see if they're efficacious and have a benefit. So how did you make this switch from the business world into the clinical research world?
So first of all, I've never worked in the business world. I've always worked in the healthcare world, and started out, in clinical trials.
So you got a
And
business degree and then you're like, hey,
yeah,
we're going to just go right into clinical research right away.
exactly,
Okay,
exactly. This is what interested me.
cool.
So I decided to, right away work in healthcare.
Hmm.
Worked on pharmaceutical clinical studies. Started out in patient recruitment
Hmm.
for different conditions like Alzheimer's,
Hmm.
diabetes, a couple of dermatological conditions, and then pharmaceutical companies wanted to get some panels going for like quality of life studies because obviously they have drugs. They know that the drugs work, but now they want to measure the impact these drugs have on the everyday lives of these patients as well. So we did that for a while with the company Citruslabs, and then COVID came about and all clinical studies came to a halt. So we kind of were struggling, waiting, what's going to happen with us. But then interestingly enough, a couple of my friends started brands in the cosmetic world, in the supplement world, in the superfood world, and they came to me to actually ask about how do we conduct clinical studies? We want to have research-backed product claims, and we want to involve research into our brand and brand strategy. So then they asked me about how much does this cost, what study design should I have, what how do I collect data, what are the methodologies that I can use. And then I decided to actually run these studies for these companies, and it was a huge success. So then they asked me, um, I asked them if they could refer us to a couple of their friends, and they said yes. So, we then conducted more studies for other supplement, other cosmetics companies, and they liked it as well, what we did, especially at that price point. And this is how we grew through, word of mouth, and now doing that for about 3 years.
Oh, very cool. We'll put link down below for your website, citruslabs.com, as well as the contact page in case you want to be in any of the clinical trials that Susanne is conducting. There'll be links down below so you guys can just click and reach out. So first off, like I'm a functional medicine practitioner, doctor, and I use lots of different supplements and nutrients. And of course, you want to use the highest grade quality products. You want to use things that are going to be bioavailable, no contamination. So if I'm a clinician and let's say I have this really well absorbed glutathione or curcumin, and I'm like, hey, Susanne, I want to study to figure out how well this thing works. How does it, like, what does that look like? Like, what biomarkers do you look at? What symptoms do you measure? What kind of patient group do you recruit? How does this happen?
Yeah, absolutely. So first, so Citrus Labs is a CRO, which stands for Contract Research Organization. And brands outsource their research to us, so they don't do research in house, but a third party like Citrus Labs. And this allows for the research to be more unbiased and more credible. And we as a CRO take care of many different things to run smoothly. So first of all, I think what we should talk about is study design. So clinical studies come in many different shapes and forms. And when you're thinking of it, does that product work, right? We first have to think about what study design is used. So typically the gold standard is an RCT, randomized control study, where you have the product, for example, curcumin, and then you have a placebo, which is typically, just a sugar pill. Some studies also, don't use any placebo. They have a control group where participants basically don't do anything, and then you measure the impact based on questionnaires, for example. So, for example, when we are looking at, for example, gastrointestinal conditions, they are amazing validated questionnaires where we can see if the product actually had an impact. But then obviously, every good research ideally includes biomarkers. We can include, for example, blood work, looking at different markers here, that it always depends on the product, which ones we are looking at. Then there can be stool samples, there can be skin swaps, for example, scalp swaps, anything you can think of can be done here. And then, basically we're looking at the impact. Now, as I mentioned before, randomized control studies typically the gold standard, but there are other study designs. There's one called a crossover study, which is part of the randomized control family. And here you have one group, and then this group both goes through the intervention and the placebo or the control, for example. And then there are also single group studies. Single group studies, as the name implies, only have one group, and typically it's just the intervention and nothing else. Now, a lot of researchers don't feel good about single group studies, but they are great pilot studies, especially if you don't really know if your product works, or if you don't really know how your product works. This can be like a good indicator to actually see if it works. And then on the other hand, obviously single group studies are cheaper, so a lot of brands run single group studies. And in my personal opinion, especially when I'm thinking of consumers, right, which study should they trust? So I personally trust single group studies more that involve biomarkers and also show an effect in before and after, in baseline and endline, versus randomized control studies that only involve questionnaires.
So for instance, if I don't have a control group, but I have this herb that's going to help modulate cortisol or increase testosterone, we could take a biomarker serum or cortisol sample before, and then we can add the intervention in a month later, retest, and then see where that biomarker sits.
Exactly.
Would you also look at like a
right.
symptom questionnaire to see, maybe libido went up, maybe mood went up, maybe energy went up? Would you look at symptoms along with that biomarker?
Yeah, we would do that as well. And, a lot of studies involve both, but unfortunately, a lot of studies, especially in the supplement superfood world, only involve questionnaires and not so much the biomarkers. So a lot of brands would kind of, chicken out of doing an actual cortisol test, for example, or testosterone test on the other hand, because they fear that, there's no effect in blood work.
So they'll look at just their symptoms instead.
Exactly. They look at symptoms, and oftentimes, you have just like study-specific questionnaires that you check for. For example, as you mentioned, libido. Obviously, for libido, for example, there are a bunch of validated questionnaires as well.
Right.
But oftentimes, they are just trying to get some check marks on their claims.
And the placebo is a real thing, and so that's a 20% potential bump. So it's nice to have some biomarkers that are a little bit more objective. So that makes sense. And so let's say someone's hiring you for a hair product that's going to improve hair count or hair quality. How do you test that? Are you doing like trichoscopies and looking and measuring hair count, or is it more just subjective stuff when it comes to those things?
Yes, I mean, hair is currently really on trend.
Oh, it's big.
And
I see it everywhere.
it is big, yes. So for hair, that's really interesting because hair, obviously you have objective things, right? But then you also have tests that participants can do in their home. So, for example, a hair fall test is something that I personally really like. So there's, for example, that brush test that participants do in the comfort of their home, and then, doing a hair count at home. Additionally, for the hair count, we often also just ask them kind of to roll their hair together, and then, place it next to a ruler. And then you can see basically, is the ball of hair bigger, smaller, or the same, right? for the baseline, midline, endline, for example. And then there's another great thing that is frequently used in cosmetic studies, which is expert grading,
Hmm.
which means that a dermatologist will actually look at, in that case, the hair, and then based on their judgment. Then makes a conclusion that, for example, hair is thicker, more healthy, has more shine to it, or even there's more hair.
Interesting. Now, tell me a little bit. So, someone comes in, they're trying to hire you for a product to provide some level of validation or make a claim based on the data. What happens when there isn't a clinical outcome that's efficacious or statistically significant? How does that work?
Yeah, that's sometimes, it happens. It's unfortunate. Um, and that typically, we see that typically happen with biomarkers.
Yeah.
But that doesn't actually mean that the product doesn't work, because, placebo effect is real. And
Yeah.
even though, you don't see anything in the actual biomarkers, doesn't mean that the product doesn't give you a better quality of life. So this is, where these questionnaires and surveys and the more like the perception of consumers tie in, and oftentimes that part is good, and that is great, and then brands can still use this part, but in my opinion, and fortunately most of our clients do that, they're actually honest, and hey, we did that study, biomarkers came back as mixed or not statistically
Yeah.
significant, but this is what participants reported.
Interesting. How do people try to fudge the data? I mean, typically what I see is people will talk about relative risk and they will never give the context of absolute risk behind it. So for instance, I see a lot with some of the older statin trials, they would look at, oh, well, you have 2 heart attacks per, 1,000 people taking this drug, and then not taking the drug, the placebo group had three heart attacks per 1,000. Therefore, the relative risk ratio is 33% less. Then they come out, big headline, statins reduce heart attacks by 33%, right? Using that relative risk ratio where absolutely, okay, I guess if you're using a relative risk, but it's really only one person less per 1,000 people taking the drug, right? That's just kind of a hypothetical. Any thoughts on the kind of the relative risk versus absolute risk and how people can kind of hide behind that a little bit without the context?
Yeah, I think, especially when you're looking at supplements and think about, does that supplement actually work? Does it not work? Right? It's not for for this industry. It's less about absolute risk, relative risk. It's more about claims and percentages.
Yeah.
It's more about 100% of participants, have increased libido after using this product, for example. And so for us, we don't forge any data. The data is
Yeah.
the data, and very interesting. What we have seen is, so this week we actually launched a consumer report, and probably some of the listeners probably feel the same, that consumers don't feel inclined to buy a product when they see 100% or high
Oh
90%
yeah. Doesn't
results,
feel right.
because they think that it doesn't. And apparently, the sweet spot is between 50 and 75%, because consumers feel that, even when a claim is just 50%, that means that every other person has an effect, and that is good enough, to kind of buy a product and try it out. But again, I think that transparency is the most important thing, and that is relevant for consumers, right? Um, and I when I see these websites, right, that brands make claims and the claims are next to their product, and then there's this asterisk, and then that leads to based on a clinical study conducted by a third party without any further information. So to me, this raises questions that everybody should ask, and it's about is this based on existing research, on ingredient research, or was this study conducted on the actual product that I am seeing, right? And
Hmm.
that I should buy? And then second, what was the study design? Was it a randomized control study, crossover study, perception study, single group study? How were the participants selected, and what were these criteria, and how many participants were in the study in the first place? What was the methodology behind the study? Methodology, basically, how was the data collected? Was it questionnaires? Was it biomarkers? What biomarkers? And then also, who conducted the study? What was the actual research question? Like, what was the study supposed to find out in the first place? And then also, how long was the intervention period? And I think that these are really the questions that consumers deserve to know. And to me, it's always a red flag when brands don't tell me more about their study. And we can't find these studies. I think we talked about earlier, how can consumers read a research paper? So that is one major issue, right? Most supplement studies that brands conduct aren't published because they only care about the results, which is the claims. But fortunately, there is a website called clinicaltrials.gov, which is a central database of clinical trials. And many brands actually do a great job with having a dedicated clinical study page in which they include all relevant data and then also link to their study on clinicaltrials.gov.
Very cool. So we talked about it earlier. You kind of hit it regarding, you mentioned the studies that aren't mentioned. You kind of gave us that resource of ones that aren't posted. But when someone has access to an abstract, which is just the front page of the study where you have kind of your methodology and maybe it has your conclusion on there, how do you go and read an abstract? If you're looking at a claim, whether it's, I don't know, saw palmetto for hair loss, for instance, how do you go look at a study? How do you go read an abstract? What do you look at first? Or do you just start from the top and go down? Or do you hone in certain areas?
So it depends what I want to find out, right? But
Mm-hmm.
for me, the most important thing is participant selection, because that kind of shows. So, for example, we talked about hair. Let's talk about gray hair.
Mm-hmm.
So some premature gray hair, leads to vitamin deficiencies, right? And if you only recruit participants that have certain deficiencies, right, and then they take a supplement that kind of helps with these deficiencies, and then their gray hair vanishes, and their natural hair color comes out again, then this kind of leads to me how thinking of how generalizable that study is, because we are now looking at a very particular subset of people, right? So this is something that I typically look at, generalizability. Who are the participants? What were the participant criteria? And does it make sense to actually make a claim then based on that?
That makes sense. Absolutely. All right. Anything else you want to kind of give us a glimpse in, just from the average person that's trying to decode research that's out there, just from your perspective, designing these studies? Any other kind of information or insight you want to provide on that?
Yeah, so I think when you're really looking at a study, I think naturally we are looking at the abstract, but read the headline. Like, typically the headline includes part of what's the research about in the first place? What did the researchers try to find out, and really try to hone in on what was the research question? And then make yourselves a little bit more familiar with different study designs, and don't demonize study designs that are not a randomized control study, because many different things go into why a company or specific business unit within the company decided not to conduct a randomized control
Mm-hmm.
study, right? It's not necessarily that they are not believing in their product. It can also just be a budget question, because randomized control studies still are expensive.
Right.
And so this is, and to me it's like, what's the alternative, right? Is the alternative to only conduct randomized control studies, or no study at all? Or is the alternative a single group clinical study that is very well designed. So this is one thing that I really wish more people would understand, that just because someone didn't run a randomized control study doesn't mean that they don't believe in their product.
No, that makes sense. Anything else you want to highlight regarding kind of cutting edge research that you are utilizing, or cutting edge technology that you're using to streamline or improve the research that you're doing at all? Anything new coming down that pipe?
Yeah, so obviously through COVID as well, a lot of pharmaceutical companies were starting to finally utilizing it, which is decentralized clinical studies.
Mm-hmm.
So all studies that we run are entirely decentralized, but even though they're decentralized, we can still utilize blood work. Blood work through CLIA certified labs, which is awesome. Some other tests like stool samples, for example, or other microbiome tests from the skin, for example, can be easily done by consumers, patient participants in the comfort of their own home, which is fantastic. So this is something that I'm really excited about, decentralized clinical studies, because it also makes studies more accessible and makes them more cost efficient.
Excellent. Very cool. Anything else right now that you think is really important that you want to highlight on the supplement research kind of front? I know that's where you kind of live most of the time. Anything else really cool happening coming down that pipe?
Um, so personally, I'm really excited about all the different supplements I'm seeing in women's health,
That's cool. Let's hear about that.
because I feel like I feel like women's health has been mostly neglected in the past couple of decades,
Well, I think what happened is
by
you had the Women's
traditional.
Health Initiative study in the early 2000s, and they used horse estrogen and progesterone. Then they saw all these cancer risks,
Yeah,
and then they were like, "Oh, okay." And then basically it was kind of like a
yeah.
pause button in regards to, well, what do you do now? A lot of clinicians like myself are using lower dose bioidentical or using herbs and things like that, but conventional medicine kind of just hit the
Mm.
pause button for over a decade on that. It seemed like, yeah.
Exactly. And it, the result was, now I think now the big issue is to convince providers that they actually made a mistake
Hmm.
in that study. Um, but that is just like one little part. When you're looking even at clinical studies, I think the first women to participate in clinical studies were in the 90s, because investigators were under the impression that our hormones would mess with the clinical study result, and that that's pretty bad. This is why a lot of dosages, for example, of drugs are more like tied towards men versus women. So there's still lots of things to do. But what I'm really excited about is conditions like PCOS or endo or fibroids, for example. They are really getting the traction they deserve, because many women actually suffer from these very women specific conditions,
Hmm.
um, and supplements are kind of filling that void.
Oh yeah,
And
absolutely.
that is something, yeah, and that is something great. And we are working with many brands in the women's health sector, not only on these conditions that are actually helping and that do great work, that are efficacious, but we're also seeing more traction on the sexual wellness front, for
Hmm.
example, and working with one company that kind of wants to do the Viagra for women, which is also really awesome.
That's cool. I want to get a little insight of what supplements and nutrients you're seeing that are working. But just kind of go back to the Women's Health Initiative study. I think a lot of drug companies, they have this zest or vim and vigor to focus on things that are patentable. Yet, the problem with using
Hmm.
patentable drugs, there may be safer, non-patentable, like some of the bioidentical options that you really can't patent. But maybe we're not going to put the research into that because there's not an ROI for all the research funding and money that goes into it. So there's that kind of component too. Do you see that too?
Yeah, absolutely. And then you hit a great point, right? Funding. So one thing that I always think, like, who would fund this,
Right.
right? So a lot of consumers, right, when they also see a study and then they see, oh, who funded it? Oh, it was actually the brand that funded it.
Right.
And then I'm like, yeah, because who else would fund it,
It's
right?
true.
Just because the brand funded their own study doesn't mean that the results are skewed or biased.
Yeah, and usually a brand they're looking at some clinical data that's already there to say, hey, we should make something like this because there's data on, I don't know, using progesterone from wild yam, and let's do our own product and our own thing, and let's see how it goes. And most people they aren't like usually creating a product out of thin air. They're usually looking at the data a little bit to say what direction should we go in. Would you agree?
Hmm. Yeah, absolutely. 100% agreed.
Now, tell me a little bit. What are you seeing coming out on the female hormone side that's beneficial in some of the studies you're doing?
That's a really good question that I actually would need to look up right now.
So off the top of your head, is there one thing that just comes to mind? I know you mentioned like some of the libido stuff or some of the female hormones or fibroids or endometriosis. Anything that pops to mind?
Yeah, so we are doing it's actually our second study with that one company, and they are kind of reviving traditional Chinese
Mm,
medicine, and it's working, and it's fantastic. And so their first study was focused on PMS, and then during that study, they were already thinking that this could also help with other conditions like PCOS, for example. So now they are actually rolling out more studies, also, in more conditions apart from, just the PMS, doing studies in PCOS, endo, and also fibroids. And it's really amazing to see how this actually helps women. And so this is one thing that I really like. But on the other side, it's also hard because our studies have only like, we have like we have, for example, 100 participants, 200 participants, 300 participants. And then when the word goes out that, products actually work, that means that, a lot of people actually want to be in that study, to actually contribute. Um, then we actually have spots. So we have specifically for our women's health studies, typically, we can recruit in like 2, 3, 4 hours. And then unfortunately, we have to, kind of say that, studies are full, unfortunately, to women that actually want to participate.
interesting. Very cool. And what about what was that traditional Chinese herb in that study that was helpful?
So it was actually a mix of, I think they have 10, 15 different herbs in there,
Okay.
which is really awesome.
Okay, cool. Any other specific nutrients that come to mind?
We see a lot of revival on the melatonin front,
Mm,
which is
let's hear
awesome.
about that.
And yeah, I think that sleep is obviously an issue
Mhm.
um, that many still struggle, and it is so the brands that we see pop up, they kind of make an entire routine out of it, right? It is not necessarily about this is a supplement, you take it and then you sleep well. It's about making a holistic routine out of it, instead of just saying take that 30 minutes before bedtime. It's a routine for unwinding that we are right now seeing, that contributes to that as well.
Any studies out of the gate that come to your mind that that you use this nutrient or this compound and it produced amazing results that you were like kind of blown away by? Anything like that that comes to mind?
So we have done recently completed a study on colostrum,
Mm,
and this is something that is still fairly new. But I know that it actually produced amazing results.
really? Excellent. And what were the parameters? Was it just immune health? Was it gut health? What was it looking at specifically?
Yeah. So we were looking at gut health.
Hmm.
We were also looking at overall, we were looking at performance, workout performance,
Hmm.
as well, and we were also looking at skin hair as well.
Very cool. Any other really cool areas you see coming up that you're really excited about regarding innovation or certain supplements, areas that are just providing amazing results? Anything that you're really passionate that you wanted to highlight?
I think we already talked about, new stuff. That's actually not that new, but that wasn't just, commercialized. Um, I think I'm also really excited about
Yes.
the whole longevity area,
Hmm.
which is pretty awesome. Um, and excited to actually test, supplements also in regards to all of these longevity clocks as well. That are quite new to actually see, if it works. Because I think a lot of these supplements, like for example, um, NAD, for example,
Yeah.
have mixed results, right? So I think I'm personally really excited about, seeing more of these studies happening. And to me, like, mixed results don't really matter, because we should look at these studies also, you know kind of standalone and see, again, what was the question, what was the research
Mhm.
question, who were the participants, what were the selection criteria, right? And then see if it makes sense, personally, to actually take these supplements or not.
That makes sense. Based on kind of your experience doing a lot of clinical trials, is there anything that you would modify if you could, right? Like if you had your magic wand to make clinical trials be more efficient as a whole, is there anything that you would modify?
So I think that, when looking at clinical trials, especially in the supplement space, we have seen, especially for these product claims, we've seen like a wide west happening recently.
Mhm.
Um, but then the FTC kind of, introduced guidelines last year in December, and basically told brands that they need an RCT to make a health claim, but there are obviously 1,000 exceptions to that. So
Right.
brands are still allowed to use third-party research about, ingredient research,
Right.
basically, to make these claims. Um, so I think to make them more efficient and to also make them more accessible, if I would have a magic wand, I would make these FTC guidelines very specific, and would give specific examples, and would not demonize other study designs
Okay.
outside of the RCT.
Are there any other products out there that there's a lot of hype behind? People think, oh, this is a great product, but you really just haven't seen the research to support its efficacy. Anything like that come to mind?
So all of the brands that we work with, fortunately, have a pretty clear understanding
Yeah.
of what their product does and what it doesn't do. And oftentimes when we are talking to brand owners, or to marketing people within that brand, they have a specific thing in mind what their product does, and then, my research team is able to kind of help them understand what's realistic and what's not
Mhm.
realistic. Um, but I think, especially when it comes to consumer expectation, I think what we are right now seeing is, we talked about it, right? That focus on hair.
Mhm.
Um, and it can actually, some products actually really work with hair and hair growth, but it only works in a subset um, of the population. So it's not so much about, not having the results. It's more about generalizability, and about, about, is, what what do consumers actually expect the supplement to do? Because supplements are supplements for a reason, right? They are not drugs, um, but supplements can absolutely help.
Excellent. Awesome, Suzanne. We'll put your links and info down below, citruslabs.com, citruslabs.com/contact. If you want to be in any of Suzanne's clinical trials, they'll be there for you. Anything else you want to leave the listeners with, Suzanne?
I think it was a great conversation. Thank you so much.
Awesome. Thanks, Suzanne. All right. You have an awesome day.
Thank you. You too. Right? They are not drugs. Um, but supplements can absolutely help.
Excellent. Awesome, Susanne. We'll put your links and info down below, citruslabs.com, citruslabs.com/contact. If you want to be in any of Suzanne's clinical trials, they'll be there for you. Anything else you want to leave the listeners with, Suzanne?
I think it was a great conversation. Thank you so much.
Awesome. Thanks, Suzanne. All right. You have an awesome day.
Thank you. You too.